2, 3, go.
Okay, so I'm the nurse caring for Kristen Stewart. It's 10 o'clock. Kristen has been admitted with a UTI. She's complaining of bilateral flank pain at 8 out of 10. Her vital signs are temp of 37.3, pulse of 92, rest of 20, blood pressure 132 over 76, and O2 sat of 98% on room air. So I'm going to compare the MAR with the MD orders. So we have Kristen Stewart, yep. April 9th, yep. The fin is the same, right? And allergies to sulfa, right? So the doctor has ordered a Hydromorph 1 milligram subcutaneous, yep. And that's Hydromorph 1 milligram subcutaneous. Q4 hours PRN, yep. And the time is 10. The time is 10 o'clock, right? And doctor also ordered dimenhydrinate in case she's experiencing nausea, vomit. So yeah, dimenhydrinate, 50 milligrams, IM, Q6 hours, PRN, and ready once again for Kristen Stewart. Okay, so a little bit about Hydromorph. So hydromorphone is a opioid analgesia, very strong painkiller, and so for subcutaneous acute pain, we're looking at 1 to 2 milligrams per dose every 4 to 6 hours PRN, and some of the parental drug monograph, it's applied as 2 milligrams, either 2 milligrams per ml or 10 milligrams or 50 milligrams per ml. Subcutaneous, it's administered undiluted. The max rate for IV push is over 2 minutes. But right, we're giving it subcutaneous anyways. So yeah, some potential hazards, side effects. Respiratory depression, that's big. Shortness of breath, cardiovascular, we're looking at palpitations, hypertension, bradycardia, CNS, some dizziness, confusion, GI, possible nausea, vomit, which is very common for any opioid, so that's why the doctor ordered dimenhydrinate in case she is experiencing these, and as well as constipation and paralytic ileus. And so additional notes, subcutaneous or IM dose onset is 15 minutes, peak effect is variable, and duration is 4 to 5 hours. And elderly may experience or more susceptible to CNS depressant and the effects. Okay, so I'm going to do, before I draw up, I'm going to do some hand hygiene here. Okay, so for hydromorphone, I have this vial here. It's supplied at 2 milligrams per ml, and the expiry is January 2028. So what I want to do for that is I'm going to calculate the correct dose first. So doctor's ordered hydromorphone 1 milligram. So that means I'm going to draw up half a minute, or I'm going to drop, half a minute fluid. So to do that, I'm gonna first alcohol swab the vial here for 30 seconds. We'll say 30 seconds has elapsed. Then, so I'm gonna inject half cc of air. This has been used quite a while, so I think the vacuum seal is kind of a little bit messed up on this, but for training purposes only. Okay. There we go. There we go. Okay. So that is 1 milligram of medication, half ml of fluid. So I will label that right away. I have my hydromorphone, 1 milligram, 5 ml, subcutaneous, given at 10 o'clock for Kristen Stewart. Okay. And now I'm also going to draw up my diamond hydrogenate. So for that, I'm going to use a 1cc syringe. And, oh yeah, I'm not sure if I mentioned, but this syringe I use for my subcutaneous is a 1cc 27 gauge by ½ inch vanish point syringe here. That's appropriate for the amount of medication I'm giving and for a subcutaneous injection. So over here I have a 1cc Lurlock syringe that is appropriate for my diamond hydrogenate, as it's supplied 50 milligrams per 1 ml, and expiry is January 2024. So I'm going to grab my filtered blunt tip needle and grab another alcohol swab to safely open this amp. Crack it as so. And I'm going to draw up 1 ml of fluid, which is 50 milligrams of medication. Okay, and safely take off the blunt tip here. And retract it. And put my safety gauge needle on here. And yeah, so my this guy is 25 gauge by 1 inch needle, and I have my 1 ml of fluid with my label here, 50 milligrams. Okay, so I have my drugs here. Okay, so I'm going to do my my second check. So I've got hydromorphone for Kristen Stewart, birth date April 9th, 1985, and it is 1 milligram of medication in half an ml in fluid, given subcutaneous, Q4 hours PRN at 10 o'clock. Okay, and then here I have my diamond hydrogenate for also Kristen Stewart, PRN 50 milligrams, Q6 hours if she's experiencing nausea, vomit. So I'm going to make sure all my medications are put away appropriately. Medications in the sharps containers, and clean up the mess here. Okay, and yeah. So now I'm going to go to Kristen Stewart's room. I'm going to ask her for her name. Can you please give me your name and date of birth? So she'll tell me it's Kristen Stewart, April 9th, 1985. and she's allergic to, and I'll ask her for her allergies. She says sulfa, and that's correct on the MAR. So just doing my third check here. I have hydromorphone, 1 milligram subcut, given at 10 o'clock, Q4 hours PRN, and my diamond hydrogenate, 50 milligrams IM, Q6 hours PRN. Okay, so I'm going to first discuss hydromorphone with Kristen for a little bit. So I'm going to tell her, yeah, so hydromorph is a very strong painkiller, an opioid analgesia, and basically it's going to help with it'll help with your pain you're experiencing. And I'll just I'll let her know some of the common side effects like nausea, vomit, constipation, shortness of breath, hypotension, bradycardia, dizziness, confusion, things like that. And I will do a pain scale on her. So I'll ask her where her pain level's at, and she tells me it's 8 out of 10. So that's an appropriate pain for a pain rate for an opioid. If it was something a lot lower, we would consider giving her something else, like an acetaminophen or something. And then her vital signs are appropriate for this kind of medication too. If her breasts were like less than 10, we wouldn't give it. If her if she was bradycardic, we wouldn't give it. If her blood pressure was super low, we would probably withhold it. But all her vital signs are good, so it's appropriate for us to give hydromorphone in this case. And then because a common side effect for hydromorphone and any opioids is nausea, vomit, I have a diamond hydrogenate as a PRN in case we need to give it. So so diamond hydrogenate will help relieve your nausea, vomit, so that she could experience. So after I give the medication, we'll assess her and we'll discuss if we should give that afterwards. So for a subcutaneous injection, which hydromorphone is, what we want to do is so we want a landmark. So I'm going to give it to her in her abdomen. I'm going to give it 5 centimeters away from the umbilicus. So what I'll do is I will bunch up the skin like so, and I will first alcohol swab it, of course, in a circular motion, and I will inject it at a 45-degree angle, bunching up the skin, slow push, 1, 2, 3, and yeah. And I'll activate once it's injected, I'll activate the safety mechanism by fully pressing on the plunger here, which retracts the needle. So that's retracted, that's great. And then I will grab a cotton swab or a 2x2 or Band-Aid, something like that, to put on top of the site. I won't massage the site, that's not what we do here. And then before I administered the drug, I would have also put on gloves and hand hygiene, always. And before I leave the room, I will sign off on the MAR here. So the date is, so I just gave hydromorphone, so the date here is 13th of March 21. Time is 10 o'clock. The reason is for pain. The effect, so I'll ask her, are you starting to feel a decrease in pain? And she'll say, yeah, it's starting to take effect a little bit. I'll ask her in 15 minutes or so, because the onset is 15 minutes. So in 15 minutes, she'll probably be starting to experience a decrease in pain here. So a decrease in pain. Perfect. And then I will initial it as UCN SN2 JG, my initials, as such. And then I'll make sure that her room is in order. I'll make sure her bed rail's up. I'll make sure her call bell is in reach. I'll ask her if she needs anything else at the moment. I'll do another set of vital signs. I'll make sure that her vital signs are still appropriate, especially her breast rate, pulse, and blood pressure. And I will, as I leave the room, I'll do hand hygiene again, take off my gloves, and I will document in my IPN notes that I gave hydromorphone for her pain med, or for her pain. I will document too if I had to give diamond hydrogenate too. If I had to give diamond hydrogenate, what I would have done is I would have landmarked it, either like vastus lateralis or the deltoid. I would have done a Z-track, so pull the skin taut, administer the medication at 90 degrees, and then release pressure. But at the moment she said she wasn't experiencing any nausea, so I withheld it. But I would periodically check up on her, and if she started experiencing nausea, I would definitely administer it. But yeah, that's about it, I think.